Digital high magnification is a process we pioneered at IVF Australia back in 2008. In this process, we can see a sperm 35 times more magnified than a sperm from standard ICSI. If we can see that, we can determine how many defects that sperm has, and we can compare it against a criteria that gives us the ability to select a sperm that has a higher pregnancy chance and a lower miscarriage rate. There are three groups of patients that benefit from this type of technique. One is patients that have very low sperm morphology, or patients that have very high DNA damage, or patients that have a lot of embryos transferred but don't seem to get pregnant. In fact, those three groups of patients have a 3 to 4 times higher pregnancy rate and a much lower miscarriage rate than standard ICSI. PolScope, or Oosight, as the technology is now known, is a software to allow us to use polarised light to image an egg. At IVF Australia, this allows us to see the genetic centre of the egg, called the spindle. The presence or absence of the spindle, or a spindle not formed correctly, gives us information about how that egg will develop. There are two groups of patients that benefit from this type of technique. The first is if you've had standard ICSI and it's failed to fertilise, or the second is when you've had fertilisation but the embryo development has been poor. PolScope, or Oosight Technology, gives us reasons why things might not be working correctly and can guide your specialist on future options.